Well, David and I have become a little bit of a tag team going across the country. I'm not sure what rock band you would call us, but we often play off of one another. And I want to begin just by thanking the Robert Wood Johnson Foundation, the Commission. I also want to thank David and the Federal Reserve for opening up our eyes about the importance of healthy communities. If you have a chance to take a look at David's paper and you see the heat maps that are in his paper, it really is a gripping visual presentation of just how tight the connection is between poor communities and poor health. I personally first heard the phrase healthy communities about a decade ago, and I heard it from someone that I respect enormously, Sister Lillian Murphy, who runs Mercy Housing in Denver. And what Sister Lillian and the foundation and David have really helped us understand is that a person's health is inextricably linked to their community's health. Your life chances and your health chances are rooted in the same soil, and that's the communities that we call home. My organization, the Low Income Investment Fund, has been working for 30 years trying to build bridges between Wall Street and Main Street. We've invested $1.3 billion and leveraged over $6 billion in public and private investments. And we have been working in the exact same places that our public health colleagues have been working day after day, and we never knew how deeply connected our work was. So the idea of healthy communities has been spectacular. It is a silo-busting vision. I got chills down my spine when I heard Risa say the word North Star, because at the Low Income Investment Fund, healthy communities, that's the way we talk, and healthy communities has become our North Star. We're pointing everything that we do toward investing in healthy families and places. So I want to make 3 points this morning. The first one is that integrative people and place strategies organized with a lead community organization. We call it the quarterback. It's like Shirley Franklin's Purpose-Built Communities, NCI, that David mentioned in Houston. That is the name of the game. And capital can be a powerful carrot to make that happen. The second point is evidence matters. We need strong, simple ways to figure out and measure success. And then third, scale matters. As someone else said before, we don't know everything, but we do know enough to act, and it's time to put a zero behind our work. I had a eureka moment about this about a year and a half ago when I visited the Booth Memorial Child Care Center in Oakland, California. This is an organization that had received a very small investment from us, a $70,000 investment. And I went to visit it thinking that what I was going to go see was a project where kids were getting child care services. And I learned quite by accident that this very small investment, which involved the removal of a 20-year-old carpet, installing child-level sinks, putting steps on changing tables, this had dramatically lowered the incidence of asthma flare-ups in kids and in teachers. And as a result, the attendance rate at the child care center pretty much popped right up from about 60% to about 90% because kids were no longer in emergency rooms. What I found was that this kind of outcome was remarkable, but it was hidden in plain sight because we were measuring child care. We weren't thinking about health. We need to start thinking across silos, and we need to act across silos, and capital and quarterbacks can be an important way to make that happen. Take the refresh example that I mentioned in my paper in New Orleans. This is a $19 million healthy food hub that's part of a holistic redevelopment of the Mid-City neighborhood in New Orleans. This is a neighborhood with 56% concentrated poverty. It includes about 500 new mixed-income homes, and it also includes this Healthy Food Hubs. Refresh, the Healthy Food Hub, is a collaboration between a private sector developer, local community groups, Tulane University Medical School, and Whole Foods. And what it will do is produce one of the very first healthy food stores in that neighborhood in its lifetime. It will also provide a teaching kitchen for Tulane medical students and a small business called Liberty's Kitchen that is providing job training for youth and is producing healthy school lunches for thousands of public schools throughout New Orleans. Financing for this has come from Goldman Sachs, JP Morgan Chase. Our role in this was really very small. It's a $19 million project. We invested $1.5 million in it, but that investment was crucial because what had happened was the project had stalled. There was a capital gap that could not be filled, and the length of time needed and the terms of the length of time the lenders could provide did not match one another. And so we were able to go in and, using our healthy food financing funds, invest $1.5 million of 20-year high-risk money. What our investment enabled to happen was that the city and other funders followed that example and extended the term of their money as well, and we closed the capital gap. The project closed, it's being financed, and it's on the way to being built. So that $1.5 million, while it's small against 19 million, was really the glue that pulled this together. And then that brings me to the third point. The third point is scale. In my paper, I drew your attention to a $50 million fund for transit-oriented development in the Bay Area. This fund finances affordable housing, but it's in the priority transit zones established by the Bay Area Metropolitan Transportation Commission, or MTC for short. It started with a $10 million investment grant by the MTC that was put there to absorb risk and hopefully attract other capital. We then were able to bring philanthropy in on top of that to absorb a little more risk. We put our money in along with several other CDFIs, community development financial institutions, LISC, Enterprise, a number of local CDFIs in the Bay Area. And then all of our investments induced Citibank and Morgan Stanley. So what started out as a $10 million commitment by the Metropolitan Transportation Commission quickly was engineered into a $50 million commitment. And while the fund is financing affordable housing, the vision behind it is much, much bigger. It's a vision of creating mixed income, walkable, healthy neighborhoods. And for a transportation agency to invest in a housing fund is silo busting, healthy communities, and scale all rolled up into one. So that brings me to the final point, and that is that evidence matters. We could be so much more effective if I could tell you these stories not just in dollars invested, but in lives changed. I would love to be able to tell you about the health outcomes of creating a socioeconomically diverse community where children get the enrichment that they deserve, parents have access to transit so they can walk and not drive to work, where kids have access to high-quality education, and everybody has access to healthy food. And if I could leave the commissioners with one wish, my wish would be that we could agree upon a few common measures that would align our work across people and place. In my fantasy wish, hopefully it will become a real wish, but in my wish, these measures would be simple, they would be common sense, but they would be tied to systems level outcomes. I take a great big leap in my paper. I'm a practitioner. I'm not an economist or an academic, but I take a leap and I propose 5 of these. But they're things like self-reported community safety, self-reported health. I'm not wedded to these ideas, but what I do know is that we need a unifying framework and we need a simple common sense way to know if we're getting the job done and if we're making a difference. So thanks again for the chance to speak. And I want to say to the commissioners, you may not know it, but the leadership that you're providing, the work that you're doing means a huge amount to those of us that are working in the field.